It's trying. And we're live on YouTube, and then we're gonna try to go live on Facebook also. Yes, so we are live on, not yet. It's trying to do the Facebook live. We're already live on YouTube. We're trying to get live on Facebook. And we should. Okay, welcome everybody to our podcast today at 6 p.m., a different time. Hopefully, a good time for everybody to tune in and watch our podcast. Today, we're going to talk about infusion, or even better known, IV therapies, because we feel they are underutilized. There's so many benefits and so many applications to IV therapy that today we want to explore those. And our guest today is Luis Gomez. He is an advanced registered nurse practitioner with over 17 years of experience in emergency and critical care. The reason I know Luis so well is because he kind of from the hospital setting into more regenerative medicine, cosmetic medicine, IV therapies, etc. So welcome, Luis.
Hey, Mike, how are you?
Doing very good today.
Good.
So tell our viewers a little bit about your background, who you are, how you got to the United States, and those types of things.
Oh, thank you, Mike. Thank you for having me here today.
You're welcome.
Long story short, I'm originally from Venezuela. My parents sent me here as an exchange student back in the 80s. So I had a different outlook in life back then, and obviously my family had different plans for me. So what happened is that I ended up in the medical business.
Mm-hmm.
So I started as a paramedic back in the 1990s. After a few years of doing that, working in the streets of city of Miami.
Oh, Miami, huh? You must have seen something there.
Oh my God, a lot of stuff. So I went on to become a registered nurse. As I did that, I started venturing in a new direction. So I wanted to become a traveler.
Mm-hmm.
I ended up traveling to a bunch of places for a long time, for about 7 years.
Mm-hmm.
Went from anywhere from Jersey, New York, Arizona, California, Hawaii.
It's a way to travel.
Yeah.
A lot of people do it.
It was awesome, man. I had a great opportunity to see new people, demographics, places,
Mm-hmm.
hospital settings, etc. So my primary concern at the time was, I wanted to be in the emergency field, because being a medic, transitioning to the ER is where most of my training came from. So during those years of traveling, I also ventured into the critical care, doing a little bit of other areas like PACU, the floor, med surg, telemetry, stuff like that, until I decided to settle down.
Yeah. How did you end up in Ormond Beach?
That's a good question. Well, story short again.
Yeah.
So I relocated to Central Florida. Wanted to focus on my bachelor's first, which I did that, and then eventually into my master's degree. So when I did master's, I figured, well, why not become a nurse practitioner? I'm really into this thing. So I did that. My focus at the time was primary care, adult gerontology. And that's what I did. I mean, I came here maybe a year and a half ago, maybe a little over that, a year and a half. Bought a house, wanted to be close to the beach.
Uh-huh.
So, and then we found each other.
And here you are.
Here
yes.
we are.
So, and then after 17 years working in critical care, emergency room, what made you decide to, hey, I want to venture out. I want to, learn more about, regenerative medicine and those types of things. How come that came across your mind?
Right. And that's, again, a very good question. What happened was that with, 17, 18 years of being in the hospital, I've come to learn that this is your traditional Western medicine. Okay. So a lot of the people seek out those type of services because either they're ill or they're going through surgery or whatever the case may be. Mm-hmm. So it's always run by protocols and really run by drugs, medications, and things like that.
Sure.
So while I was doing that, I figured, well, there's chronicity is getting worse over time, obesity, diabetes, heart disease, etc. It's the same vicious cycle. People keep coming back for the same
They're
problem.
managed, but they're not taken care of.
Correct. So I wanted to make a difference. So I started looking into different venues. When I found regenerative medicine, is hence the reason why I'm here today.
Okay, well, very good. So Luis works at the Ormond IV Launch. You can go to the website ormondivlaunch.com. It's a great website, and it has all the information on it. What we're going to talk about, the different IV therapies that they offer, the different conditions that they treat. Besides that, they do also regenerative medicine, stem cell therapy, PRP, and a whole bunch of cosmetic procedures. So check out that website, ormondivlaunch.com. But today we're going to talk about that infusion or IV therapy. So explain, Luis, what is IV therapy? And what are the benefits of IV therapy compared to, for example, taking supplements or oral medication or things like that?
Right. So what happens with IV therapy is that what I've learned through all these years in the ER and the critical care is that with IV therapy, you have a great advantage. This great advantage is that you have 100% bioavailability, meaning that anything that you put in your stomach, you have to go through that process through the stomach, versus getting an access through a vein or an artery or whatever the case may be, and then delivering those nutrients directly into the target organs that we're trying to get to.
Yes.
So that means that with intravenous therapy, we're reaching 100% bioavailability, and we're able to get to those organs.
And that's the absolute key here today, because that's why I feel it's underutilized. We can take supplements, even if they're good, high quality supplements. We can take organic foods, but all of that needs to pass the digestive system. So the question is, how much of those, effective nutrients or nutrients that we need are actually ending up on a cellular level? We just don't have the answer. However, if we would, get those nutrients in our vein, in our system, we know 100% of them are going to be absorbed on a cellular level. And that's the great advantage. And that's, what we're going to talk about is the benefits and the applications of that. So now IV therapy is also used in hospitals,
right?
Because, I've been there not too long ago. You sent me there, remember? That's a different story, guys. But, I avoid hospitals. I avoid doctors, but I had to go. And so even before they did anything, they didn't know anything. They didn't even know what I was there. But the first thing they always do, especially go to them, is they put you on an IV for hydration, right? So why is that? And are there other types of IVs that they use in the hospital setting?
Okay, well, in the hospital, typically and traditionally, what they do with IV therapy is either treat nutritional deficiencies, obviously dehydration, being one of them. The other is if you are coming in with, let's just say, heart failure, or you're coming in with an overdose, or you're coming in with any kind of ailment or issue. So we have protocols. We have IV therapy protocols with drugs and certain medications to treat those conditions. We know that with being given this treatment, we are correcting the problem, we're reversing, and we're getting them to a functional level, to where they can go ahead and move on and feel better. But then again, we don't know if they'll get better over time, because they just keep coming back. Correct.
Because the cause is not taken care of. But it's also, I guess, for people that, I guess especially the elderly, that are unable to eat at the time too. It's a way of providing actual nutrition, correct?
Right. So unfortunately, a lot of this happens in the hospital. But again, we still bypass those what we call malabsorption syndromes. These people go back to their normal lives that they once had before. They go back to that old diet that they were involved with, or the level of activities. And look at it this way, Mike. There's a lot of issues going on with diabetes alone and obesity.
Sure.
That's one of the biggest problems in America nowadays. So they don't treat that in the hospital.
A much bigger pandemic than
they don't treat that in the hospital
than our current one.
Right. So all we do as clinicians in the hospitals is obviously we see these patients, we make recommendations, and it is our sincere hope that they follow through.
So we're gonna go over some of the applications that the IV therapy can benefit, but just to get the viewers interested already, sum up some of the benefits or the applications that IV therapy is used. I know it can boost immunity. It's used for wellness, for hydration. What else?
Well, we're having now cocktails,
Yeah.
whereas we're treating not only hydration status, like for dehydration, but also we're doing hangover cures. We're doing NADs. We're doing alpha lipoic. We're doing B12s, glutathiones, vitamin C in high doses or conventional doses.
So it's a combination of all kinds of vitamins and nutrients, and there's a cocktail, like you call it, a combination of nutrients specifically designed for a certain condition or a certain treatment.
Right, correct.
Okay, go ahead. So we can use it for athletic performance. We can use it for depression. We can use it for headaches, for migraines, almost for any condition.
Correct.
Okay. What is the difference between an IV and a shot or an injection then? Because with an injection, I guess we could put it in a system too. Mm-hmm. So what are the difference between the infusion or the IV and just giving a B12 shot, for example?
Right. So with an intravenous access, we have immediate effects. We can see, the intended effect within a minute or two, 10 minutes, 15, 30 minutes. Whereas with an intramuscular injection, in this case, it's more of a sustained effect. It can last days, weeks. It all depends on, on how you take care of yourself.
And metabolize too.
Yeah.
But yeah, the IV is immediate. But with the IV, I read too, you can administer at least 10 times more vitamins or nutrients than you could do with a shot.
Correct. So what we really do is that, we are literally based on protocols. We try not to overdo or underdo things. Mm-hmm. But based on these is how we deliver right at the exact amounts so that we can enhance these people's immune system or hydration systems or whatnot.
Before we get more specific on how our viewers actually could benefit themselves coming to the Ormond IV launch, what is the history of this infusion therapy and how did it come by?
Yeah, good question, Mike. So I go back in my research times, and there's this gentleman by the name of Dr. John Myers. In the 1970s, he created a therapy, whereas it became later in time as the Myers cocktail. So this famous Myers cocktail, through time and after thousands of patients, we have come to realize that it does help. It does help with anywhere from...
There were many studies done.
Yeah.
And patients were followed.
Right.
Yes.
So we were treating fibromyalgia, respiratory condition, illnesses, infections, and they were coming back feeling a lot better.
Yeah. Because we know whatever we gave them was absorbed, right?
Correct.
And otherwise we wouldn't be able to do that with oral medication even. Now, we said there's many nutrients that we use. We're not going to go over all of them, but let's discuss a few of the nutrients that, that are kind of popular and that we can get an IV for. Mm-hmm. Obviously, I think immediately about vitamin C, not just because we're in this COVID pandemic and there's, a lot of literature out there that vitamin C would be helpful boosting immune system. A lot of viewers don't realize that there's thousands and thousands of peer-reviewed scientific research studies out there published in scientific articles, finding on PubMed, not just 1 or 2 thousands, all over the world for many, many decades that show all the benefits of vitamin C. As a collagen builder, as an antioxidant, as an immune booster, it's all out there, okay? So this is nothing new. But again, our body doesn't produce vitamin C. Chickens do, but we don't, right? So we need to get that from our fruits and our vegetables or our supplements. But again, what a better way to get the vitamin C through an IV therapy. So I've had those done before, 20 grams, 25 grams, 30 grams. Mm-hmm. So, but it seems like in the United States, Louis, there's this notion that too much vitamin C could be harmful. What is your take on that?
Well, let's begin with the basics. So with vitamin C, as you already know, vitamin C exists in a lot of the foods that we normally eat on a daily basis. Unfortunately, here in the U.S., with the diet, the American diet, I call it, unfortunately, we don't get enough vitamin C. So a lot of people tend to go to the way where they want to get supplementation. So when they get supplementation, they're not really truly able to reach the therapeutic level with
Yes.
vitamin C. So normally for a therapeutic level, it should be like 9.3 milligrams per deciliter, whereas with IV, you are getting at least 15, if not more. So when we're reaching this therapeutic level, guess what we're doing?
Yeah, we're healing.
We're supporting collagen. We're improving our immunity. We feel better overall. So, it is important that we focus on the vitamin C, especially during this pandemic now, because as you mentioned previously, there are ongoing research with this COVID-19 and how we can help suppress, and then boost immunity in all these patients.
Yeah.
And it has come into our attention that all these studies are coming actually from China, where they're saying that high doses of vitamin D are helping these patients tremendously.
And again, it's all coming up now, but these studies have been there for decades. Vitamin D, vitamin C, you can find those on PubMed and anywhere else. Now, I personally always have supplemented with vitamin C. As an athlete too, again, it rebuilds, collagen and muscle, and it keeps your immune system up, but it's also an antioxidant, meaning it fights the free radicals. Because as an athlete, you produce far more free radicals than the average person. Your metabolism is much higher. You cause those free radicals, and that's why a lot of athletes that are not taking care of their body and just train, they do get in trouble. And it's important that, especially when you're an athlete, you not just take antioxidants from your food, but you really need to supplement. And even when I feel under the weather, Louis, my protocol is when I feel under the weather or when I feel I may get something, preventatively, I start taking vitamin C. Actually, my first dose is always about 4,000 milligrams. And then every hour I do 1,500 milligrams, until I feel better. And it always works. So that's a good tip. But, if I just could get an IV, it would be all absorbed and it would be much more effective. Yeah. So that's vitamin C.
And let's not forget, vitamin C in high doses have been known to kill cancer cells.
Well, he said it, okay? He said it. We had a podcast on cancer. In other countries, they use high-dose IV exactly to treat cancer patients. Over here, obviously, it's illegal for the obvious reasons. We're not going to go in that today. But besides vitamin C, glutathione now is one of those studied antioxidants. It's an antioxidant that our own body produces, and it is related to aging and many other things. So tell us a little bit about glutathione a little bit more and what the benefits are in getting an IV of glutathione.
Right. So just like any other product, but glutathione is what we call the master antioxidant. It fights oxidative stress. It also helps you build more immunity again, also treats conditions like diabetes, Parkinson's, and things like that. But what happens with glutathione is that as we age, our body stores become depleted.
Yes.
So we have to somehow replenish those stores. So we highly emphasize on glutathione because glutathione does help enhance that.
It's the master antioxidant.
Yes.
So,
absolutely.
So an easy way to get it again is IV because it would be a maximum absorption. We just already mentioned vitamin D. Most of us are deficient in vitamin D. It has so many important functions in our body. We know we can get it kind of through the sun, right? But most of us are indoors most of the time, right? We're lucky we're in Florida, but even people anywhere else, by the time they leave work, it's already dark or rainy, and really we're deprived of sunlight. So vitamin D supplementation again becomes very important.
Right. So it's just kind of like the same concept with glutathione. Vitamin D, we also get it by dietary means. And again, our bodies become depleted over time. It's very important. Vitamin D is not only a vitamin, but it's also a hormone.
Yes.
And we need it for strong bones. It also helps fight depression and anxiety and stuff like that. So we don't get it enough by our dietary means. Yeah. So it's very simple. All we do is we check a level to see if you're deficient. And if you're deficient, we get you started on intramuscular injections. So we get to a third. Exactly.
And it's much easier controlled with an IV than with supplementation. Because again, with supplementation, we don't know how much is absorbed and how much the levels are going to increase, if at all. But with this, we know what we're giving them and we know what's absorbed. B12, everybody talks about B12. B12 is known amongst the people for, it gives me energy, So what about B12?
Well, B12 is actually another area of interest. So with B12, we use it to treat levels of B12 when they become depleted again over time. There's also some conditions like pernicious anemia, or some malabsorption syndromes, and by just getting it from our dietary means doesn't really fill in the gaps. So we try to get it on the side by getting the B12 shots to try to bring those levels up to normal.
Yeah, we talked. I don't know, when I talk about fibromyalgia and muscle pains and things like that, when people have muscle cramps and muscle pains and they're fatigued all the time, there's a few things you should test. Many times it's hypothyroidism, right? Then we got low folic acid levels, low iron, and low B12. So it's very important that you get a lab test done based on your symptoms, that we assess the levels and then optimize those levels, right? And B12 is one of those things that can cause a lot of those muscle cramps and fatigue and those types of things. Right. That's why they say it gives you energy, because initially it causes fatigue, right? Yeah. What about biotin?
Well, biotin is becoming very popular nowadays. Why? Because biotin had been known traditionally to help with hair, nails, and skin, but also it helps to bring down your cholesterol, and it also improves your metabolism. Mm-hmm. So it's becoming more notorious nowadays because everybody wants to feel good, look good. Yeah. Right. So biotin is definitely something that you can definitely get with us and help you. Yeah. Feel better.
I used it years and years ago. We used to do a procedure called mesotherapy where we actually injected nutrients for all kinds of purposes. And biotin was always a part of a skin rejuvenation protocol at the time. Right. Still nails, is. Hair, skin, and still is, but it has more properties or benefits than just that. What about alpha lipoic acid?
Alpha lipoic acid, it's really great for neuropathy. It also helps regulate diabetes. It kind of helps regulate A1C levels. It also helps you with weight loss. It's also being used for vitiligo, people who suffer from vitiligo, or people who recently had a CABG, what we call the coronary artery bypass graft. So it's becoming very popular as well, especially in the weight loss arena.
Yeah, very many applications. We use it together the last few years for all our neuropathy patients, right? Because it has a really good effect in the scientific literature in regenerating or helping to regenerating nerves and small diameter nerve fibers. What about magnesium?
Well, magnesium is actually a very good topic because magnesium is actually a natural occurring vitamin. So being that we are also deficient in that area, but why is magnesium so important? Is because it helps treat asthma. It also helps treat depression. There's some malabsorption syndromes, seizures. That's what we do in the hospitals. Yeah. And it is also very essential for nerve and cardiac function.
Yeah, it is used in the hospitals. I know that. We also know that a lot of research, you mentioned depression, because so many people are on antidepressants, and it's proven in scientific literature that magnesium actually works better than those antidepressants without any of the side effects, especially the increased suicidal thoughts. I think that's kind of important. You don't have those thoughts with magnesium, so try magnesium, and the best way to get it absorbed is again through the vein. Also helps with headaches and stuff. Mostly why? Because many headaches are caused by what? Tense muscles, tightness. And so magnesium is a relaxant, is a muscle relaxant, right? So it relaxes the musculoskeletal system. Magnesium, I always like magnesium. There's always been a misconception also that calcium is so important for bones. And now more and more research actually shows that it's not calcium that's important for the bones. Actually, many types of calcium are detrimental to bones, especially the ones coming from cow's milk and things like that, actually increase the risk for osteopenia, osteoporosis. But magnesium is the key component in, preventing any osteopenia, osteoporosis.
Correct.
Do you agree with that?
Yes, I do agree.
Because that's what the latest research shows. So it's not about popping calcium pills and those types of things. It's about having proper levels of magnesium is much more important there. What about hydrogen peroxide? We all know about hydrogen peroxide, right? We have it in our house, but he's going to inject it in your veins. So why would we do that?
Well, believe it or not, hydrogen peroxide is used. So with hydrogen peroxide, what we're trying to do, accomplish, is help bring more oxygen in your body. Okay. So again, we tailor only what the body truly needs.
Sure.
So in this case, it's only 3%. Anything over 3% actually is toxic to the tissues. But the whole concept behind the hydrogen peroxide is that it helps treat infections. It helps bring up more oxygen into the body. It treats COPD, pneumonias. It's antiviral, antiparasitic. I mean, it's unbelievable what it does.
Yes.
And a lot of people are seeking this type of
And it
service.
does. And it has something to do with vitamin C, because that's why vitamin C is an antiviral.
Right.
Because it turns into hydrogen peroxide in your body.
Correct. So when we do, especially that protocol, we try not to give them together because, again, we make...
You would overdose that way.
Exactly. So we have to do it on different visits. But this is a treatment that we like to administer to people who actually suffer from cancer. Because those are the ones that seek out this type of treatment modality.
Yeah. The one I'm interested in, Luis, because we had it in our supplements during our Neomatrix medical days, is NAD+. It's a cofactor that's found in all of our cells in the body. It's essential, or it plays a central role in metabolism. And now there's plenty of studies out there that show how it has a positive benefit on anti-aging, how it slows down the aging process. Explain a little bit more about that.
Okay, well, NAD plus is something that we all have in our bodies. Not a lot of people know about it, even though it's becoming very popular. Why? Because it's being used a lot for detox purposes and to increase performance. It in low doses, it helps improve your mental clarity. In higher doses, it treats opiate addiction, for instance. So we become depleted again as time passes, as we get older. So we do have protocols for NAD infusions, anywhere from the anti-aging aspect of it to treat opioid addiction as well.
To treat opioid addictions. I mean, that's one of those ingredients that have been studied so much in the last 2 years that is becoming very popular, and the results and the benefits are pretty amazing.
I have a lot of patients who are coming back and really loving it. The first time they have it, they want to get it again and again and again.
And it's one of the benefits of IV therapy. You feel the results pretty much immediately, unless we're treating a chronic condition and people have to come in for multiple treatments.
Right.
But if it's something acute or something for energy, it works immediately because it's absorbed immediately.
Right.
Yeah. Now let's discuss some of the various applications. We talked about hydration. What if somebody wants to boost their immunity? We talked about vitamin C. What other nutrients would you recommend, or go into those cocktails to boost the immune system?
So especially for the to boost the immune system, I always recommend the Myers protocol cocktail plus the vitamin C, the high dose vitamin C.
And what's in the Myers cocktail then?
Well, the Myers cocktail has a complex of magnesium, calcium, vitamin B's complex and stuff like that.
Okay. Very good. And then we talked a little bit about skincare and beauty with the biotin. If people would want to come in to get an IV for their skin and for beauty purposes, what else is in those cocktails besides the biotin? Yeah,
well, we have zinc that goes alongside with that very well. And also we have a vitamin B complex.
Okay.
So that's usually the cocktail specifically tailored for the skin, hair, and nail treatment.
Yeah, because people don't realize that the skin is still our largest organ.
Right.
And so we need to feed our skin from the inside. Yes, we can do Botox and fillers and it works and it makes people look better. But if you want those results to last, and if you want actually to optimize the results of the external treatments, which do work, because we both know about those, you got to get heal your skin and nurture your skin from the inside. And that's where those IV therapies come in. Athletic performance. And obviously, when I was preparing for my world record last year, we did some of the IVs, mostly to recover from the very intense workouts in the pool and obviously at bodies. Thanks, Tasso, killing me there. So I needed to recover for the next, workout. So athletes can come to recover fast. And what would the nutrients be in those types of cocktails?
Okay, well, very straightforward. Sodium chloride infusions, which is your typical normal saline. It could also be lactated ringers.
Electrolytes?
Right. So as far as electrolytes, again, we like to throw in the B complex, the vitamin C's, which will help replenish.
So it would be great to replenish, especially when we're talking about, athletes that do marathons, running, triathletes. If you want to compete during the weekend and if you want to recover so you can go train again, you need these, infusions. You will recover much faster and you will feel it too. You will feel it fast. But besides recovery, again, I want to stress the free radical damage that we athletes, when we perform or we train at high levels, most athletes are not aware on how unhealthy that can be, because we're not just moving, we're not just stimulating circulation and oxygenation and helping every cell in the body. We are breaking our muscles and our body down. And it needs to not only be repaired, but we need to take care of that extra free radical damage. So from my point of view, every athlete needs an extra amount of antioxidants to offset those free radicals. And that's just from a health point of view, so we don't drop that. And then number two, if you really break down tissue and if you really feel your body needs more protein, I wouldn't suggest a protein shake or I wouldn't suggest eating more meat. What about putting amino acids in a cocktail?
Right.
Talk a little bit about that.
So, that the amino acids traditionally comes in the vitamin B complex infusions. So plus the glutathione, it does help with that as well because it brings all those into light. But that combination alone does the job very well. Because
we got essential amino acids and non-essential. The non-essential ones we get from the food, but we still need to get the essential ones. And so this would be a great way also to get those amino acids in our body to rebuild and recover much faster. Okay. What about, you mentioned the hangover, is that just hydration or?
Yeah, it's just straight up hydration.
Flush it faster. Is that what it is?
Flush it fast as you can. So some of these folks will come in with headaches, nausea, vomiting. So that's when we have to introduce, some medications like Toradol or Zofran or something like that.
So that's a combination of a hydration cocktail or basically IV with some medicines.
Yes, correct.
And that just gets it done like that?
Yeah, just like that. It works like that. Beautiful. Works within minutes.
All right. Hopefully I don't have to use that one anymore. But for those out there that still, drink a lot and don't want to feel bad the next day, you can get in contact with Louis here. What about weight management, weight loss? How would those IVs fit in with that?
That's a very good question, Mike. So with that, we have to understand that with just IV alone, it doesn't really treat weight loss. So we like to do the alpha lipoic acid infusion, but also we recommend that you engage in a healthy diet, and then obviously, you get into some kind of a workout regime or exercise regime to kind of help support that. But in essence, what happens with that, over time, you will definitely get those results.
Yeah. So it's basically an adjunct to a healthy lifestyle. I know you guys offer a weight loss program also. We probably will have a podcast on weight loss. It's always been a very interesting topic.
Right.
Many misconceptions on weight loss. But again, weight loss, there's obviously an imbalance in the body. And there's many deficiencies that cause weight gain. Right. And so it's all about identify those deficiencies, and then an IV therapy would be the fastest and most effective way to address those and optimize those levels back to normal. But what Louis is saying is we wouldn't be addressing the cause. And that's why we still need to look at, changing the diet and looking at lifestyle changes. You guys also do detox, but better even chelation therapy, right?
Yes.
How does that work?
Well, with chelation, we have a special cocktail for that. It's a chelating agent, EDTA. We know this from based on research. During the World War II, there was a lot of folks who got sick from arsenic, from cadmium, from lead.
All the toxins.
Right, from mercury and stuff like that. So what we do is
those are all the things that are in vaccines, Louis.
Well, that's
we're not going to start there.
That's another podcast.
Okay, so all toxins. So what does chelation do? How does it work then?
It just binds with this, products, and then it gets excreted through the kidneys.
So the body doesn't have a way to get rid of it. So those toxins are floating around. And with chelation therapy, we're injecting. What was the main ingredient you said?
EDTA.
EDTA. What
Yeah,
is
there's
that?
a scientific name for it. It's a long name, but it's
We'll
called
keep it short, EDTA.
EDTA.
And so those toxins are able to bind on it, and that's the way it's able to excrete from our body finally.
Correct.
Okay, excellent. So, I mean, you know, do we do a test to find out if somebody has those levels?
Yes. So what I like to do is we'll have a conversation with the patient, whoever's interested in this type of service, and I will send them out for some blood work. And then once we get these levels back, then we can tailor.
And I like tests all the time when it comes to blood tests and things like that, because we can have a test before, we can do the therapy, and then we can do the test after, and then we know if the therapy was effective. Right? Very good.
Most importantly, these patients will definitely report that they're feeling a lot better.
Yes, of course.
Yeah. So we're not
I mean, what people don't understand is that toxins are the cause of all disease. And I explain it often. The cause of all disease is toxemia. Toxemia means toxins in the blood, right? And it's normal that we have toxins as a result of living, as a result of our normal metabolism. Our body produces toxins, waste products. But our body also can eliminate those through the kidneys, through the skin, etc. So no harm is done. However, when we ingest or exposed to far more toxins than our body possibly can eliminate, then those toxins accumulate in the body. Or when they fall into the body has no way to break them down and get rid of them, right? So those toxins in the body floating around, toxemia, causes two things. Number one, these toxins steal an atom from an electron from a healthy atom, and that healthy atom now becomes a free radical. And free radicals cause damage on a cellular level, right? But also these toxins cause a state of emergency. And in medical terms, it's called systemic inflammation. And even conventional or Western medicine tells us today that over 90% of all disease is directly related to systemic inflammation. So if we want to control or prevent disease, we need to control toxemia. So we need to reduce the exposure and ingestion of toxins, which has a lot to do with diet and medicine and the way we act, you know, the way our lifestyle is. But at the same time or simultaneously increase the nutrients that combat systemic inflammation and free radical damage. And chelation therapy could help with getting those toxins out of the body, okay? So that's really what we need to do. Now, let's talk a little bit, because it's an interesting topic, addiction. How can this help with addiction?
Well, with NAD, what we do is that we're not only trying to target, you know, the fatigue and the anxiety and depression that's highly associated with addiction, but with overtime and of course, you know, with the aid of getting rid of this products, whatever you're using, you know, we can help you improve from a mental standpoint over time.
Okay.
So
that needs several treatments.
Oh yeah, they need at least 4 times a month, once a week.
So there is
a higher dose.
So there is a protocol in place to really treat addiction. Any type of addiction?
Yes, specifically opiate and alcohol.
Specifically opiate and alcohol. Okay.
Yeah.
And then migraines. I know so many people in my close environment that have migraines and headaches. They're on medications like Topomax and all kinds of other medications. They seem to help short term when they take it and the headache goes away, but then obviously the next morning the headache can be back. And it seems nobody has a solution for that. How does this help, and does it give long-term results?
Well, based on the studies from Dr. Myers, it seems like the Myers cocktail has been one addition to treat this ailment. You know, it's something that we would have to follow those type of patients very closely, because they're not all the same. Headaches have different etiologies.
Sure.
So, you know, with migraine specifically is something that we would have to follow very closely. But Myers cocktail have been known.
And may it be because there's magnesium in the Myers cocktail?
Yes, but in addition with the B's and the C's and the D's and everything else. Yeah. So, you know, as we already know, we are deficient in those areas. It does affect your brain negatively. So with the Myers cocktail, we're able to overcome that.
Okay. And, you know, another important point to make here is, you know, the medicines and all the other therapies, they all have adverse reactions, especially the medicines. You know, even if people try this for a migraine, Louis, worst case scenario, it didn't work for the migraine, but you get all those nutrients in, and there's certainly no adverse reactions. If anything, there will be other positive things happening.
Right.
Correct?
That's true.
So nothing to lose here. Now, how long does an IV therapy treatment take? What is the protocol when you come in? How long does it take to get one of these IVs?
Well, typically it takes anywhere from 30 minutes to 45 minutes for the very simple infusions. When we're talking about, chelation or NAD, they usually are a couple hours in the office.
A couple hours?
Right. Could be anywhere from 2 hours. The most complex is, when we're treating opiate addiction, for example, that's usually an 8-hour course.
In one day?
In one
so
day.
They're all day 8 hours for addiction?
Yeah, but that's to treat that. We have that one protocol to treat that.
Okay.
So that's probably the longest that we
But
have.
like if you're an athlete or migraines, usually an hour you're in and out?
You're in and out anywhere from 30 minutes to an hour.
Okay. And what is an IV push? Because we can have the needle in and sit there for half an hour until the bag is empty. What's an IV push? Explain that to our viewers.
Intravenous push is actually kind of like a medical jargon. It's just basically a medication in a syringe. You're pushing it
in the IV
into the IV, and it's just getting to where it needs to be fast.
Yes.
So
and then the saline is dripping through for hydration the rest of the half hour,
correct.
Even though the medicines are pushed in a few seconds.
Exactly.
Okay.
Exactly. So
what's the purpose of that?
Well, the purpose is like, for instance, let's just say you have a headache or you have nausea, vomiting. So we can treat those immediately with an IV push. So we'll give you, IV push of Toradol, or Sulfran, or Phenergan, or medication.
Versus waiting an hour or half an hour until everything's okay. That makes sense.
So it's done fast within a couple of minutes.
Is there any pain or hurt involved getting an IV therapy?
Well, again, in my opinion, I think it starts from the medical professional who's doing the procedure.
Experience on who puts in the needle, right?
Yeah, that's very important. Also, there's a lot of misconception. I still see it in the office on a regular basis, but a lot of people think that when they come in, they're getting an IV, the needle's still in the vein, and it's not. All you really have is a plastic catheter. Okay, we just do the needle to pierce the skin. So,
the needle doesn't stay in. You pierce the needle, and then the catheter stays in for that half hour, but the needle's not there anymore.
No, correct. Okay. And there's a lot of people have that misconception, unfortunately. Yes. But we try to explain that. Very subtly. So, but it could be anywhere from a pinch to a little bit of pressure.
Just the needle.
It really has to come from the patient, how the patient.
But there's no pain or discomfort while the drip is going and while you're sitting. I know you guys got comfortable recliners there.
Right, not at all. Yeah.
So you just chill
and we
out.
have the meditation earphones and all that good stuff. So, but yeah,
it's a spa-like experience.
Our personnel is highly trained. They know how to do IVs. They're very good at it.
I don't know what's happening there. Let's see. All right, we're just going to move on. So is there any downtime? Once I walk out of the office, is there anything I need to do? Or
no, not really. Just move on to your normal daily activity, your lifestyle, whatever, wherever you are at or whatever you want to do, accomplish. No downtime. If anything, you should feel better.
Okay.
Within an hour or two.
Are there any risks to this treatment or possible side effects or anything like that?
As with any medical treatment, there are always risks. So with this, the only risk that I can advise everyone is that you may have minor bleeding, maybe a little bit of bruising.
Just from the needle prick then, basically.
Right, and that's it. There's always that distinct possibility of getting an infection from the site. But we give all of our patients, they get instructions when they leave, and we give them our contact information.
But it's the same with any injection.
It goes with anything.
Yes, exactly.
But,
Is there a possibility of any type of overdose with these nutrients?
No, absolutely not.
Absolutely not.
No.
There's nothing is too much.
No.
And I agree with that, because if the body doesn't need it, you will excrete it. Correct. That's why many times when you take bad supplements, your urine becomes yellow, right?
So correct. So let's keep in mind, and that's the thing that you brought that concept up, because IV therapy is not made for everyone. Okay. That means that if you have a history of congestive heart failure, or you have a cardiovascular problem, hypertension, if you have chronic kidney disease, those are the patients that...
So there are contraindications to this therapy.
That would be it, yeah.
Okay. What about cancer?
Well, I love cancer patients because I really believe in this vitamin C high dose infusion.
Especially even if they are on the radiation or chemo treatments, which I don't recommend, but even if they're on there, getting these IVs in between really makes them recover much faster, and at the same time it helps with the nausea, the vomiting, and those types
It
of
could
things.
potentially help them with that. A lot of these naturopathic doctors are doing it nowadays. They're not only focusing on supplementation, but they also want to do this high dose vitamin C's, and in addition to the hydrogen peroxide.
Yes.
Yeah, not together, but
Yeah,
separate occasions.
Separate occasions.
Right.
Now, how often do you recommend people get an IV like this?
It's patient's preference. If you want to, come in on a weekly basis, we can do that. Typically, we don't like to do it more than twice a week. But you can be engaged on a weekly infusion.
I guess the best thing is to talk to you, see what the condition is that you come in for, what your goals are, and then come up with a customized plan, I assume.
What I would like is for people to come see me. We'll talk. We'll have a nice dialogue. We'll explore patients' preferences, ideas, thoughts, and according to what they need. If we need to send them out for blood work, we can do that as well.
Mhm.
And then again, revamp and redo it.
Very good. I guess we kind of covered anything. Is there anything else you want to share with our viewers?
Well, thank you very much for participating this evening. Please visit my website, hormoneivlounge.com. And then if you have any questions, please don't hesitate to
reach out. It's a great website. I looked at it. I was jealous. It was done very well. HormoneIVLounge.com. They're right here in Ormond Beach. And again, besides having a very comfortable IV lounge, a bar, I think it's the only one in Ormond Beach. I know they have one in Orlando, but it's right here in Ormond Beach. You can get all those cocktails.
Yes.
Right? You can get healthy. And at the same time, they have so many other services there that you need to check out. They got all the cosmetic services, the lasers, the PRP, the stem cells. They got it all. It's a very nice place to check out and get healthy. Louis, thank you so much for being here.
Thank you, Mike.
And
thanks, everyone.
Always choose health freedom. Okay, and then